Are there new fertility-sparing treatments for cervical cancer patients? Imagine being diagnosed with early-stage cervical cancer and wondering if you can fight the disease while still having a chance to have children someday. The good news is that medical advances are making this possible through a variety of fertility-sparing options. These treatments are designed for women with small, low-risk tumors who want to preserve their ability to conceive. One common approach is the removal of the cervix while keeping the uterus intact, called a trachelectomy. This surgery can be done through the vagina, abdomen, or with minimally invasive techniques like laparoscopy or robotic surgery. Vaginal trachelectomy tends to have better outcomes for future pregnancies. It is usually offered to women with tumors that are 2 centimeters or smaller and without high-risk features. Studies show that cancer control with this procedure is comparable to more radical surgeries like hysterectomy, making it a safe choice for carefully selected patients. Another option is conization, which involves removing a cone-shaped piece of tissue from the cervix that contains the tumor. This procedure also includes checking nearby lymph nodes to see if the cancer has spread. Conization is suitable for very early-stage disease and can preserve fertility, especially when combined with thorough lymph node assessment. For women with slightly larger tumors, between 2 and 4 centimeters, neoadjuvant chemotherapy can be used. This involves giving chemotherapy before surgery to shrink the tumor, making fertility-sparing surgery more feasible. While this approach is still being studied, early results are promising, showing that some women can preserve their reproductive organs after shrinking the tumor. When treatments like radiation or chemotherapy might harm the ovaries, techniques such as ovarian transposition can help. This procedure moves the ovaries out of the radiation field to protect their function. Additionally, freezing eggs, embryos, or ovarian tissue before treatment offers options for biological parenthood later on, either through assisted reproductive technologies or surrogacy if the uterus cannot be preserved. Overall, the trend in cervical cancer treatment is toward less radical surgeries that balance effective cancer control with preserving fertility. Multidisciplinary teams including gynecologic oncologists and fertility specialists work together to create personalized plans. While these options are mainly suitable for early-stage disease, ongoing research continues to refine these techniques and expand options for women wanting to keep their fertility intact. If you are facing a cervical cancer diagnosis and are concerned about fertility, it is essential to discuss all available options with your healthcare team. They can help determine the best approach based on your specific tumor characteristics, overall health, and reproductive goals. Remember, every case is unique, and advances in medicine are making it possible for women to fight cancer while also planning for their future families.